Hey guys, my name is Zanik and today is day 18 and we'll be looking at healthcare and diabetes. Right? So let me start by saying diabetes is a chronic illness, right? You would be living with that disease for the rest of your life, which means you would be heavily dependent on our healthcare system for the rest of your life, right? And it is a costly illness, um, from paying for medication to your management supplies, your test strips. It is costly, right? And I would imagine that it takes a lot for our healthcare system to provide us with some of those things. In my previous videos, I spoke about insulin and how we have the universal healthcare program where we are provided with some insulin and syringes, right? Which is a luxury, I would say, which is not afforded to other people in certain parts of the world, right? But a lot of places do offer insulin to their citizens. So to all the other countries out there, that is amazing, I find. I cannot imagine what it would be like if I had to spend $500 a month US just to purchase insulin. And the thing is, you need that drug to stay alive. You cannot live without it, right? So I totally understand how people living with diabetes, their cost and their dependency on the resources is a lot, right? So I'm especially thankful for that program that provides us with insulin, even though it is not advanced. My ultimate my ultimate wish would be for them to provide more advanced medication under that same program or at a lesser cost, right? I don't mind paying for it, but if we can drop the cost just a bit, that would be amazing. Yeah. So also, the St.Lucia Diabetes and Hypertension Association there's a program ongoing there right now. It's called Life for a Child, right? In collaboration with the International Diabetes Federation, IDF, where children between the ages of 0 to 23 are provided with testing supplies, which includes a glucometer, the test strips, and the lancets. The lancets are the small needles to prick your finger. All right, they're provided with these things on a monthly basis, right? So every month you would get your 50 strips, and I'm not sure how many lancets, but that project is amazing, right? That project, I'm so grateful for that project. I was on that project. Now I no longer qualify because I keep getting younger. But for the kids, that is amazing, because as we were speaking about the cost of diabetes, it is expensive. It is expensive. And to have one cost taken care of, right? That is amazing. That is a big help, and I would love to say thank you. And Life for a Child, they provide that program to many different parts of the world. It's not provided everywhere. So consider St. Lucia blessed. Yes? What else? The OKEU, the public hospital, provides a clinic, a diabetes clinic, where we see certain physicians, right? And for a reduced cost, or no cost at all. I think it's like 15 EC to see the doctors at that clinic. And my only thing for me, the disadvantage in that clinic for me, is the amount of time it takes to actually see the doctor. So it basically takes half of my day, especially when I'm at work. So that's my only downfall, but I love it, especially the doctors there and the nurses who go above and beyond for the patients that are living with diabetes. So most times when they have the clinic, they would have a education session, almost like a group therapy session, where we sit down and we talk about what is going on, diabetes related, and persons share their experiences. And I think people get an opportunity to see a young child living with diabetes and what it is like for them. And then we see an older person living with diabetes and they share their experiences. And it's amazing. Okay, you get to see that you can grow older with diabetes. It is not a death sentence. And the older persons, I think they're amazed. They're shocked to see that now we have more children living with diabetes. So these nurses at that clinic actually go above and beyond, and it is amazing. So thank you. Actually, this month, the theme for diabetes awareness is actually nurses and diabetes, because they just had to show the role nurses play in terms of a patient's diabetes care and diabetes management. Okay, they help with the education, and just checking in. It's good to have an amazing relationship with your nurses and your physicians. So what I would like to see for our healthcare system is for more advanced technology to be provided in St. Lucia. Not necessarily for free. I'm not looking for anything for free, really. But at a cost. I'm fine with the cost, just to be provided, just so we can have access to that piece of technology. That by itself is a lot. We can meet you halfway and we can figure out the rest. But that is my ultimate wish for our system. Thank you guys for watching, and stay tuned for more.